This is Dr. Corey Maas on Looking Your Best. I've had a number of patients that I've seen now. We're not seeing that many over this quarantine period, but those that I've seen and talked to as follow-ups have had a lot of questions, and there have been many things that are left unanswered or little things that they've left out in the government statements. One is, there's a few things that are clearly true. The virus is deadly in a very tiny percentage of our population, particularly the elderly, obese, with diabetes, high blood pressure, and smokers. And those people are really at risk. If you have that combination, you should really be quarantining yourself and not going out at all, as much as you possibly can. The other thing that's absolutely true is that younger people and people that don't have those risk factors barely get ill at all. But it's not true that they're totally asymptomatic. That's been permeated through some retrospective studies that were done of familial clusters in China, with patient 0 being a person who was presumably, by his recollection, not symptomatic. Almost everybody has symptoms that has the virus of fever, malaise, which is muscle weakness, coughing, and shortness of breath, or one of those things at least. The other falsehood that's out there is a lot of people believe that we can quarantine everyone and the virus will go away. That's just not true. The virus is too pervasive, it's too widespread, and it's too contagious. And what we need to do to beat this virus is to get half of our population to have antibodies, which is getting those low-risk people exposed and having a short illness, and then they get the natural immunity that will not allow the virus to spread any further. Once we're at 50% or greater, it starts to go away. And that should really be our goal, without having a lot of hospitalizations or people having the complications. So I think that the truth is there. And as we move forward, we really need to be careful with our at-risk people. We still need to do measures to make sure we don't have huge spikes of people that get the virus, even though it's very small in the people that are not at risk. We can't have huge spikes because that potentially exposes many, many more of the at-risk people. And the folks that are at high risk really, really need to quarantine. I just can't emphasize that enough. As we open up, that's the direction we'll be going. So if you get sick, you've got to go home and you got to get tested. There are plenty of test sites now. You can find them online. They're all free. And you want to quarantine yourself for a couple of weeks, you'll be fine. And that way everybody doesn't need to quarantine. We're creating a whole separate health crisis and a whole separate set of issues with homelessness and hunger and nutrition and all these other things that are happening by having everyone stay home, which is not winning the war on the virus. Winning the war on the virus means we all acquire antibodies that are not at risk or at low risk by getting exposed and getting better, and that's how we beat this virus. If you have any questions about it, let me know, drmaas.com. I'm happy to help you at any time. Dr. Corey Maas, Looking Your Best.